Bone grafting and implant dentistry, building a foundation for success. In the world of dentistry, dental implants have become a popular and effective solution for replacing missing teeth. However, in some cases, the patient may not have enough bone in the jaw to support the implant. This is where bone grafting comes into play. Bone grafting is a procedure that involves taking bone from one part of the body or using synthetic bone material and placing it in the area of the jaw where the implant will be placed. This helps to build up the bone density and provide a strong foundation for the implant to be attached to. There are several reasons why a patient may not have enough bone in their jaw for an implant. One common reason is due to bone loss that occurs when a tooth is extracted and not replaced. Without the root of the tooth stimulating the jawbone, the bone can begin to deteriorate over time. Additionally, some patients may have naturally thin or weak bone structure in their jaw, making it difficult for an implant to be successful without additional support. Bone grafting is a common practice in implant dentistry and has a high success rate when performed by a skilled and experienced dental professional. By building up the bone density in the jaw, the patient is more likely to have a successful implant that will last for many years to come. There are several different types of bone grafting procedures that may be used in implant dentistry. The most common type is called a socket preservation graft, which is done immediately after a tooth extraction to prevent bone loss in that area. Another type of bone graft is known as a block graft, where a piece of bone is taken from another part of the body and attached to the jawbone to build up the bone density. In addition to these procedures, there are also synthetic bone graft materials that can be used in place of real bone. These materials are often made from minerals that mimic the properties of natural bone and can be just as effective in building up the bone density in the jaw. Before undergoing a bone grafting procedure, it is important for the patient to meet with their dentist to discuss their options and create a treatment plan that is tailored to their specific needs. The dentist will evaluate the current state of the jawbone and determine the best course of action for building up the bone density in preparation for the implant. After the bone grafting procedure is complete, the patient will need to allow time for the bone to heal and integrate with the existing jawbone before the implant can be placed. This healing process can take several months, but it is important for the long-term success of the implant. In conclusion, bone grafting plays a crucial role in implant dentistry by building a strong foundation for the implant to be attached to. By addressing any deficiencies in the jawbone, the patient is more likely to have a successful implant that will last for years to come. If you are considering dental implants but are concerned about bone loss in your jaw, talk to your dentist about the possibility of a bone grafting procedure to ensure the success of your implant.